Hi everyone, in this video I'm going to be discussing how machine learning can be used to classify and predict gestational diabetes in pregnant women. With the help of this model, we can accurately identify and diagnose gestational diabetes so that proper treatment can be provided. So let's dive in and explore how machine learning can be used to help women in this situation. Predicting the risk of gestational diabetes in pregnant women can help healthcare providers to identify and manage the condition early in order to minimize any potential complications. Using machine learning is classified and predict diabetes risk during pregnancy is a promising approach that could help healthcare professionals to identify and manage diabetes more efficiently. Gestational diabetes is a type of diabetes that occurs only during pregnancy and can have serious consequences both to the mother and to the baby. So I'm going to walk you through step-by-step process from data preparation to the modeling and evaluating our model in using Google Colab. So on my Google Colab, Google Colab is a platform used to run Python applications, and this Google Colab is good for research purposes. I can put comments, I can put sections and segments for me to explore and for me to explain my own modeling processes. The first section here is talking about the topic and the aim of our data set. Our data set is Pima Indian data set. So our aim is to classify this data set with an outcome of if the patient have a diabetes or not. So we are going to predict, we are going to classify. Then with 75% of our data, then we predict with 25% of our data. The second section here is all the libraries that are used in our Python coding. Some of the libraries we used in order for us to extract data is Panda. So Panda helps us to explore the data set of Pima Indians that we've uploaded to the Excel. This data source is in Excel spreadsheet. We've added it to our Google Drive. Then we were able to explore the data using Panda, and we are able to see the data here. So we have pregnancy, we have glucose, blood pressure, sicknesses, insulin, BMI, degree, diabetes pedigree function, age, and outcome. Outcome is if the patient have diabetes or not. Now we have to explore the information about our data set in case there are empty values, null values, so that we will be able to manage these null values. But for this data set, there are no null values. And from there, we look at the shape of our data. We look at the heat map for the null values. If there's any null value, it's going to show us on this heat map. And after, we go through to do a descriptive analysis on the data set. This gives us the mean, standard deviation, the minimum, the maximum, and the percentages of our data set. Then after that, we do the exploratory data analysis. With exploratory data analysis, we'll be able to have insight to the data set, what the data set contains, the learning outcome. Here we can see that there are more of data leaning towards 0 than 1. And we can see the skewness of our data set here. So for each of the attributes in our data set, we are able to see how skewed they are. Then after that, we are able to divide our data set into two features: the features of pregnancy, blood pressure, sickness, and age. And we have another segment which is for glucose, insulin, BMI, and pedigree, and diabetes pedigree. After that, we model our database. In modeling our database, first of all, we were able to do the correlation matrix to see how our database works. What's the correlation between the attributes? Then we move through modeling our database by using naive bias and check the accuracy of our data set. Thank you.